Good evening. My name is Joshua Rue, and I will be your nurse today. And today I'm going to be talking to you and educating you a little bit more about fluid volume deficit, otherwise known as extracellular volume deficit. Today I'm just going to be going over the basic pathophysiology, some of the symptoms of it, what you may see in an assessment, the labs that can help diagnose it, what I will be doing to take care of you, any potential complications or medications that go along with this, and I'll be giving you some more education about how to control this in the future before you go home. So I'm going to start out with some of the basic pathophysiology of fluid volume deficit. All right, so the extracellular volume is found in the body in the space between the cells and inside the blood vessels. It has 1/3 of the total body water, and the remaining 2/3 of the body water are inside of the cells. Now, fluid volume deficit occurs when there is not enough fluid in the body, and this can occur from anything as severe as hemorrhaging, gastric bleeding, or renal issues, or it could just be as basic as vomiting, diarrhea, profuse sweating, or just not taking in enough water. And the concept of fluid volume deficit is often confused with dehydration, and they are very similar in some ways. However, fluid volume deficit is most related to isotonic dehydration, in which it is an equal loss of both water and electrolytes from the body, whereas dehydration has two other classifications, such as hypertonic or hypotonic. Hypertonic is when more water is lost, but there is still more electrolytes, and that's generally seen through vomiting and diarrhea. And hypotonic is when more electrolytes are lost than water, and that can be seen in water intoxication. But fluid volume deficit is seen in isotonic dehydration, in which an equal amount of water and electrolytes are lost. Now, as you saw when you were admitted, we do several things to assess for this. First, we start off by taking a detailed health history. We ask questions about any past illnesses you have, any family illnesses, what your occupation is. Is it something that you spend a lot of time out in the sun? Are there any recent medications you've been taking, or have you been sick lately, primarily or mostly focusing on whether you've had diarrhea or vomiting lately? Next, we move on to an examination of you. We'll start by testing skin turgor, and we generally do this by pinching the skin above the sternum right here and then letting go. And if it tenses or stays in the same place for several seconds, that is a sign of dehydration. And next we go on to check vital signs. We check pulse and blood pressure, and generally those are lowered during ECV deficit. And then we go on to take some lab tests. Primarily we take a sample from urine and blood. And moving on to the lab test, there are 3 ways we can test for ECV deficit. First one is through urine-specific gravity. And in that one, we check the concentration of urine. In this case, the concentration of urine is elevated because there is less water to dilute the urine. And this is seen mostly in the urine being a dark amber color, kind of like when you wake up early in the morning to go to the bathroom, the color of that. Another way is we look at the hematocrit, and the hematocrit is the number of RBCs, or red blood cells, in the plasma, and it's elevated because through ECV deficit, there's not as much fluid, but the red blood cells stay constant, so it shows up as being elevated. And the final is the blood urea nitrogen to creatinine ratio. Generally, that should fall between 10:1 to 20:1. But if it's over ratio of 20:1, it indicates that vital organs such as the kidneys may not be getting enough blood and could cause further complications. All right, so I'm going to move on to how I am going to help you, and just various interventions to help you get back to health. So the number one most important thing I'll be doing is constant monitoring of your vital signs, making sure you're moving back to that 6,100 beats per minute, or the 120/80 blood pressure. We will set you up on secondly, we will set you up on an IV, or if you're not vomiting, have you get oral intake of fluids. And beyond that, I would also make sure the IV site was not infected. We'll be constantly monitoring your input and output, either myself or the nursing assistant personnel. We'll be watching you for falls. Through ECV, you may have some confusion or dizziness, so we want to make sure you're safe whenever you have to ambulate either to the toilet or just for range of motion. We will weigh you to make sure that you have not gained too much weight in a short time, which could be indicative of fluid excess. We would help you eat and drink if needed, if again with weakness. And we would also teach you and encourage you to intervene in the future if you ever find yourself in a similar situation. All right, now with our treatments, there could be potential complications, and I should go over that with you. Through IV fluid, there is always a risk of fluid overload and the complications that go along with that. With low electrolytes, there could be the risk of seizures. Again, through confusion and tiredness, there's also a risk of you falling. You could have hypothalamic shock, which could eventually lead to death, but our personnel here at the hospital are very well trained. We are constantly monitoring you every 30 minutes to an hour, and we will always be checking on you to make sure that does not happen. And some of the medications that we will be giving you to help you through this: the IV fluids to help restore water and electrolyte balance. And if you were having vomiting, we would give you some antiemetics. Diarrhea, we would give you some antidiarrheal such as Imodium, and for fever, antipyretics such as Tylenol. And of course, these do have some side effects. Mostly with the IV fluids, there is potential for complications from too much fluid entering the body, but like I said, we're constantly monitoring you, keeping an eye out on you. And just a little bit of teaching before you get ready to discharge. If you were working outside, you need to always be monitoring how hot it is, how much water you're intaking, whether you've gone to the bathroom a lot or not at all. And just be monitoring. If you stop sweating, that is a sign you are dehydrated and you need to replenish. All right, and I have all this information written out for you. I have it all right here for you. Your call light is right there. If you have any more questions for me, please do not hesitate to ask. Thank you so much.